Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. In understanding anatomy of foot, the terms are important to understand when we're dealing with the talus and the calcaneus in the hindfoot, the tarsal bones, including the navicula, the cuboid, and the cuneiforms, and of course the metatarsals and the digits. We can see the lateral column, a relatively fixed column created by the calcaneus, the cuboid, and the fourth and fifth metatarsals, as opposed to the medial column of the foot. Consider the talus, the navicula, and the medial, middle, and lateral cuneiforms, as well as the first three metatarsals. The concepts of foot into segments proposed by Inman help us to understand the biomechanics of the foot, looking at the posterior segment, which includes the talus and the calcaneus, the midfoot segment, the tarsal bones, and the forefoot segment, including the metatarsals and digits. You can see that on the axial plane as well. His model included the medial column and the lateral column denoted by the asterisks. When we're looking at technique, we had a study that compared calcaneal pitch angles to whether or not x-rays in full weight bearing could be used to assess information about gait analysis. And they found and compared images obtained from dynamic video fluoroscopies and found indeed that full weight bearing x-rays are similar to the position during gait. So we can use these x-rays as a way to understand gait analysis. And when we're thinking about how we take our x-rays, it can be useful to have apparatus where the patient steps up to the plate so that the beam can be perpendicular to the area of interest. We'd like to come out with weight bearing in full 90 degrees where the tibia and the floor angle is 90 degrees. That's an excellent weight bearing x-ray. We can also take frontal views in weight bearing. We want to direct the central beam about 30 degrees towards the base of the third metatarsal. And in those types of images, we can see the medial aspect of Lisfranc articulation here. In the medial oblique view, we have the central ray again directed towards the third metatarsal, and we're then going to angle our beam and be able to see the lateral aspect of Lisfranc articulation and the lateral column with great clarity. The hindfoot alignment view, a very useful view to understand whether or not we have hindfoot varus or valgus. By obtaining this view in a 20-degree declination, we can see the calcaneus, comparing that to the tibial angle and the inclination as such, very useful to determine alignment. The long axial view, also a great view, 45 degrees to the dorsal aspect of the foot, really demonstrating wonderfully the posterior subtalar and the middle subtalar facets with the comparison of the distal tibia and the calcaneus, where we can again determine the presence of varus and valgus alignment on this long axial view. Is partial weight bearing sufficient to read our x-rays and draw this information? And when we compare things like this one here, where it's 60 degrees at the tibial floor angle, as opposed to 90 and even greater degrees of 102 degrees, we can take a look when we have in the situation of pes planus. In this case, let's take a look. In the neutral position, notice that there's a line drawn along the talus and the first metatarsal, that's Meary's line, and we can see that that's relatively neutral, no break in that line. But when we put the patient into partial weight bearing or full weight bearing, we can see the severity of the patient's pes planus, which was not evident when we were not in weight bearing. Notice also the simulated weight bearing here, the plantar declination between the talus and the first metatarsal in a partial weight bearing state. It still shows us some of the features, but not as well as it does in the full weight bearing status. Are you ready to take your podiatric imaging skills to new heights? Check us out at radpodsquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.